Hello, everyone. My name is Manny Ramos, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. Our guest for this episode is Dr. Riza Mauricio, who's an advanced practice nurse in pediatric critical care medicine and assistant professor of undergraduate studies at the CISIC School of Nursing at University of Texas Health. Riza was inducted as Fellow of the American College of Critical Care Medicine in 2015. She's the chair of Quality and Safety Committee of the Society of Critical Care Medicine, a journal reviewer of the journal Pediatric Healthcare, chair of the Practice Committee and of the COVID-19 Heal Our Nurses Kabalikat program of the Philippine Nurses Association of America. Riza is also a board of trustee of the Philippine Nurses Association Metro Houston Foundation, and the PNAA representative to the Nursing Collaborative on Environment and Maternal, Child, and Women's Health, and to the Texans for Healthcare Access, and the chair of the Philippine Collaborative on Planetary Health. Riza also served as a past board of director at the American Association of Critical Care Nurses, and a past president of the AACN Houston Gulf Coast chapter and past president of PNAA Metro Houston. Riza's research interests are in the quality of life of children and adolescents and was the co-primary investigator on quality of life measures of children and adolescents with progressive cancer. Riza is also the primary investigation for age-appropriate early mobility activities of critically ill children, anticoagulation strategies for critically ill children. Riza is also a speaker, a lecturer, for several educational presentations. So, Riza, good evening. How are you?
Hello, good evening, Manny. How are you
Risa,
doing?
it's Mindy
Glad
here.
to be here with you.
Hi.
Hi, Mindy. Glad to see you and hear you
thank
again.
Yes. So now you had your undergraduate education in the Philippines, right? For your BSN?
Correct. I graduated from the University of San Carlos in Cebu City. We were actually the first batch. I'm always a trailblazer, Manny and Mindy. So whether here or I also trailblazed the advanced practice at Texas Children's Hospital in Houston. And the same thing in the Philippines when I was in college. We were the first batch at the University of San Carlos. So it was fun. It was a fun group, and it's always nice. I don't know if you guys know University of San Carlos. It's entrenched into engineering, and they have a lot of actually top-notch engineering students graduate, especially in the College of Chemistry.
So from the Philippines, did you go directly to Texas?
No, I did not. I actually worked in the Union Carbide Philippines. So Union Carbide, there's Union Carbide. The mother organization is Union Carbide of America, right, in the United States. And they have an Asian corporation as well, so a branch of them, and we're part of that. So I started actually as an industrial nurse, and I should have been hired and in Davao City, but then I changed my mind when I was offered that job because obviously the pay is much higher. So when you're young, you go for where the money is. And so that's what I did. And I was conflicted initially whether that was the right route for me because, you go into nursing, you thought you would serve people. But then my dad said, he gave me a book. My dad is a very intelligent man. And instead of telling me to do or, what to do or not to do, he gave me a book to read. And from that book, I found out that it's really not, you don't necessarily have to follow the book. In your path. You can also create your path. And exactly what I did. And so even when I was an industrial nurse, I was into already taking care of advocating for the community issues. So I would go, the first time I developed a program for that organization, I developed a program for the workers. So I
Uh-huh.
would go home visit.
Wow.
Imagine that I would go home visit house to house and then create a preventive program. So I went
Mm.
into vaccination. I don't know if you remember in the Philippines that the government will have
Mm-hmm.
stocks of vaccine, and then it's not well established, I would say, because I cannot recall before that that is part of us entering school. So that was my program to promote vaccination among families, including
Yeah.
especially on children. And the people in the United
Uh-huh.
States were impressed with that program. So that's how
Yeah.
I started. And then later on, with how the Philippines was going, I got married. I decided to come over here thinking that I probably would give a better life for my children if they are here. And that's how it started. I came over, and after a year, I promised myself and my family that if I did not get them a visa, I would go back to the Philippines. And with the blessings from above, I was able to get a visa. So they were able to come over here, but that was
Mm.
a long and trying year to be waiting for your family. I had two kids at that time. So they
I see.
finally came over and we
New
started in New
Jersey.
Jersey. And that's where I started. Yeah, New Jersey. That's where, in Secaucus, New Jersey. It's like
Uh-huh.
an hour from New York City. And that's how I started my critical care nursing. I love critical care that I never left since then. Until now, I'm
I
still with critical care.
I'm a
So,
critical care
Yeah.
nurse too, as a background.
yeah.
And how did what was your experience with regards to your family was in the Philippines and you as adapting to a new
Mhm.
environment as a nurse?
It was certainly difficult because I had my two girls. I had two girls and a boy. The boy was born here. The two girls were 3 and 5. So those were the ages that I think,
Mm-hmm.
not that they don't need their mommy at all when they're bigger, but even when they're young, they need their mom, right?
Yes.
Those are the formative years. And I'm always for psychology. That's my niche. Like I thought I'm gonna be a psychiatrist, but psychology, right? So I knew the first 6 years of life is really important to an individual, but I wasn't there for at least a year at least. So that's why I said I promised myself that if I cannot be with them in the next year or so, then I have to go back to the Philippines. And I was blessed that I was able to get them a visa. At that time, there was a
Mm-hmm.
visa called Family Reunification. And so
Ah,
I got them. And then after another year or two, we got an immigrant visa. So it wasn't like the long, arduous road that a lot of Filipino nurses have experienced. So we were away for a year. And going back to your question, Mindy, it was hard. Lots of tears, probably more than a drum of tears flowing. But you have to do it. I always have a goal in mind that eventually when they come over here, it's going to be better education, and always having education in mind. That was the reason why we want them to come over here. And I think with that, the girls matured very quickly because there was no mom that will be with them. I
ah,
mean, my sisters were there and helped my husband take care of them, and as well as my parents and my husband's dad. But then I think
mhm,
it's different when there's no mom. So my
mhm.
my best friend will always like call me or tell me that you know the house is different when you're not there, and how it's being set up
Ah,
is different. But then my siblings would say, "Oh, the kids have gotten fat now because you're not there." Because I won't allow them. I mean, when they were growing up, they're not allowed to eat chips or those. Those food, they always need to eat healthy. Even when they were babies, I would like mash those potatoes or what have you, vegetables. So no ramen, those kinds of things. But when I left, they eat a lot of ramen. They eat like those barbecues along the street with lots
Oh,
of
I see.
dust. So they eat those. That's why my brother said that they became healthy because now they're eating all the germs and their immune system is now robust because of
Oh
that.
my
That's so funny. So,
gosh.
Yeah,
Yes.
it was
so
funny.
Risa, when you started nursing, pediatrics wasn't your specialization. So, what brought you to pediatric critical care medicine?
It was
Uh-huh.
critical care,
Uh-huh.
but not necessarily pediatrics because when I started in New York, New Jersey area, it was always
Mm-hmm.
been adult in critical care. When I came to Houston, I interviewed
Mm-hmm.
many institutions and only one pediatric institution,
Mm-hmm.
and that's Texas Children. And then I was
Mm.
impressed. When I reflected on it before I took the job, I think this would be better for me because I really like kids. I like developmental, progression of children and how, the brain is formed, along those lines. And I said, so maybe I can do something when
Mm-hmm.
they are in intensive care. So that morphed into quality of life of children and
Mhm.
family. And it's true too that they smell much better than the adult. No offense to adult people, but they smell much better and they weigh lesser than the adult people. Because I would recall when I was in New Jersey, for instance, in one of the critical care unit that I was in. I mean, when you do when you do dialysis with a 200, 300 pounder, oh my God, it's a lot of load on you, like physically,
Mhm.
mentally, emotionally, everything. And I think, I was convinced then that it would be easier physically for me taking care of them, not knowing though that I was immersed in a very emotionally laden environment. Not that you don't think much when you're taking care of adult in an ICU, but I think for children, because you still think of their future and
Mhm.
what future they will have if they are, chronically ill or maybe even in the intensive care and then eventually will have a chronic condition, much less having a life-threatening illness that they come to you all the time that would just affect the progression of their growth.
Mhm. Oh, well, you've been an APN, Advanced Practice RN in a critical care unit. So, how did the pandemic affect you?
So it was it it's not particular specific on being a critical care, and I think it's like the same as what everybody was feeling when it started, that it is difficult to be in an environment where there were a lot of uncertainties. I mean, at the beginning, when the pandemic started, no one knows what to do, including PPE. Should you mask? Should you have an N95? And the PPE was also in short supply. So that was more of the difficulty to me, not very much about critical care. And at that time, too, there were not a lot of kids sick
Mm-hmm.
with COVID, right? It was mostly the adult. So this increase in the incidence of COVID
Mm-hmm.
admissions happened when the Delta variant came in. And
Mhm.
because a lot of the adults, especially those that are 65 and older, have been vaccinated, and this
Uh-huh.
age group that I'm taking care of are not. Until
Mm.
finally, there was a vaccine for the adult
Mm-hmm.
adolescents and young adults. That's the you know 12 now to
Right.
18. And so at the beginning it wasn't. So basically it was the same as everybody, fear of anything, fear of the unknown, that I don't know what's going on. And then in the intensive care, which I think is similar to other intensive care, you're around with a slew of people and social distancing cannot happen. And there was no regulation at the beginning of how do you round with everybody in the intensive care when there's a lot of specialists that you round with them together, because there's certainly more of advantage when you round with other disciplines, not only, the ICU during rounding. So that adds more to the number of people during daily rounds. So that was it. And then, us being a provider in the intensive care, we do a lot of invasive procedures, and one of those is intubation. But then quickly our leadership recalibrated and said, just have the physician to do the intubation. So there are specific group of people that can intubate. And so we are not exposed at all to it, because I was scared, intubating kids. And we know from the beginning that the transmission is through that route. So that really scared me a lot. I was getting paranoid and many more. And you just have to, again, to be, prayerful and make sure that you take care of yourself, which is actually very hard. It's easier said than done. I try to take care of my staff, but again, easier said than done. But eventually you recalibrate, thanks to God, and hone your resilient skills. So now, even though that, we're still in COVID, at least there is some little bit of comfort. But I always remind myself not to be, just confident about it and nonchalant about things. But because COVID is still there no matter what. The good thing about it is because I am vaccinated, so there's a bit of confidence in taking up invasive procedures or be with other people, even though, when you're around or when you're in intensive care, there's many of you and social distancing is not happening. Let's just be honest about that. But we are masking and we are vaccinated. So that's
So,
better.
Risa, here in the US, the FDA, the Food and Drug Administration, already gave full approval for the Pfizer BioNTech COVID-19 vaccine for children aged 16 and older, and an emergency use in the children 12 to 15 years of age. In your encounter with families with their children, what is the atmosphere there? Do you get a lot of questions related to it?
A lot of, you
To
mean
the
related to
vaccine
COVID?
and to the COVID, yeah, specifically for the pediatric population.
Yeah, they do have, the question is really about the safety.
Okay.
And so what we do with children alone, I mean, we talk to parents and families a lot, right? And whether it's about the COVID condition or the COVID disease alone, even though their children are not admitted because of COVID, there are parents. Not all of them are in the intensive care because of COVID, right? Even though that their children are admitted not because of COVID, you still get question of the COVID disease and the COVID vaccine. And so the atmosphere in the intensive care is the same thing as when in any critical care environment. There's not much change except when they know that a neighboring, patient has COVID. They would try to, retract from that area, which is good. They don't need to be there. There are also families that are recalcitrant in trying to think of, the vaccination because they think that no amount of vaccine can prevent them. And that's usually a challenge. However, I think when families ask me those, you always want to ask about their story, much as you would offer their story as well. So when they ask me about question of COVID disease, I would give examples of kids that are admitted because of COVID. And in the critical care environment, I would tell them, while there's a lot of kids that when they get admitted to the critical care, they go home just fine, and some of them with oxygen. However, there's percentage of those kids that are in extracorporeal membrane oxygenation or ECMO. So
Mhm.
requiring, in other words, I don't use the word ECMO to the family. I just said requiring more technology one that more than anyone else, and are in the ICU longer than anybody else. And there's a lot of reason for that. So I gave them who are those kids that are staying longer in the intensive care because of COVID, right? And those are people with comorbidities, certainly. So one, I'll tell them a story about that, how this family is agonizing about, how their child has COVID, and this mom has to
Mm-hmm.
take care of other children. And in addition to that, she herself, for instance, I gave this mom a story about another mom who has other children to take care of. And
Mm-hmm.
she's a single mom. And so that and coming to the intensive care and
Mm-hmm.
taking care of other kids, she doesn't have, an army of support to handle all of those, in addition to a single mom, a single breadwinner. And so if she is divided between children in the ICU and children at home, who's going to take care of their food? Who's going to, where would they get money
Mm-hmm.
to buy food on the table? And so I said to that family that there's definitely a lot of burden when you have that kind of disease. So that's why it's very important that their children need to be vaccinated if the vaccine is available, because
Right.
there are still ages that doesn't have
Right.
availability of vaccine, right? The
Younger, no? Yes,
younger
yes.
than 12 years of age.
Mhm.
Uh-huh. And so that is still not available. And I said, plus the fact too that the science of COVID is still new and we don't know what's going to happen to our kids that will have COVID. Yes, they are going home. Some of them are just on oxygen. So, better than children that died, definitely. But then again, you don't know what's going to
Mm-hmm.
happen to them in the long run, because we know that in the adult science, when this
Mhm.
happened last year, a lot of the adults got sick. And the science that's available for those adults that went home, there's a lot of complications, what
Mm-hmm.
they call the neurobrain,
Right.
that they get foggy. And so think about a child that still has a developing brain, and then eventually, because they're sick with COVID, that complication happens to them. So what's going to happen to
Mm-hmm.
their brain development or their
Yeah.
development in itself? So I
Mhm.
give them examples of what's potentially going to happen so that they can mull and think about it, especially those that are hesitant and recalcitrant to vaccines. And, I respect, especially those that have
Mm-hmm.
negative opinions of vaccine. I respect their opinion because, diverse
Mm-hmm.
people have diverse ideas, but then also having them realize what's going to happen if they don't have, because there's solid research now that has shown that if children are exposed to unvaccinated group of people, whether it's adult or other children, hence those that are going back to school, and they are with friends or classmates that are unvaccinated, they get it as
Right.
well. And
Mhm.
what if they get it and they are those small percentage of kids that become
Mm-hmm.
very, very sick and would be on, cardiopulmonary support, right? And what's going to happen to them in the future. And so telling them a story, definitely to have that understanding. And I also, when you dig deeper
Mm-hmm.
into family's life, you would also realize that actually the reason why they don't want the vaccine is not because, or they didn't get the vaccine themselves as an adult, it's not because they don't want the vaccine, because they don't have a transportation to go to the vaccine hub, or they cannot
Mm-hmm.
afford to be off
Mm-hmm.
work because, if they're off work, then they're
Yeah.
not paid, right? Because
Mhm.
there are places, there are employers that if you don't work, you don't have a pay. So if you're the only breadwinner in the family and you're not paid even for a day or two, because, some gets a vaccine for that day, the following day they're still off
Mm-hmm.
because of whatever side effect.
Quiet, quiet.
I think especially me that got a vaccine, I have to sleep. I have to sleep the whole day. So that would require 2 days already. And some people can afford to have that. And so I think those are the things that we need to consider when talking about people. Certainly, what is important, I think, for me, talking about COVID, this disease and the vaccine, it's important to have that understanding and communication, because that's the only way I think we can help one another. Because if you don't have that dialogue, then, and you just pretend that, someone is foolish or someone is, acting not right and labeling each other, the more we would be at war with each other instead of helping one another. And I think that's just my principle of taking care of people.
And other than the disease processes that you have mentioned and treatment, what have you, what other things that you have learned from this pandemic?
I mean, many things. I mean, to begin with, if you talk about communicable, like just community nursing or community health, we were not ready with this pandemic, right? And I think we all know that. Not only we in the United States, but the whole world. But come to think about it, I always rely on science and always relying on the United States being the grand, nation that can support R&D, the research and development, or always ahead, especially in terms of technology. But then we were not ready with the pandemic because we don't even have that group of people that were tasked to do, emergent or emerging diseases, communicable diseases. That was, I think, abolished by the previous administration. So not going into politics, but just the reality. And in fact, there was a congress or a conference of experts in infectious disease and virology the year prior to, I would say, when COVID hit. And we all know, the world know that we were not ready because there were a lot of action plans that needed to happen. That did not happen. And then this COVID hit. For instance, I mean, as nurses, we know this. There were no PPEs to begin with. So we were all scared. Like, how can you take care of, an infected person? You know that transmissibility of the disease is so high, especially with this Delta variant. But then at the beginning, you also know that the transmission is very high, but you don't have the proper PPE to take care of them. Imagine I wore an N95 that was worn by another person the previous day. I mean, come to think of that, that has never happened in my life, in my 30-some years in the United States, but it did happen. And for United States to be doing that, right? We're supposed to be the standard of care. And I know they said research has shown that it's okay. In a way, it's disinfected or sterilized or what have you. But still, that's in your mind that this was worn by another person. And some of them even have like the makeup marks. But you have to use it because there's nothing else that you can use. I mean, and you have to wear an N95 because you're taking care of patients. And, just things like that. And you have to have a goggles as well to be going around. So you go around with a foggy goggle. And it was really a truly amazing adjustment. So that's one in terms of what have I learned. The other thing I have learned also that none of us have been to any pandemic, right? I should say none. I think there was an over 100-year-old lady that was in the flu pandemic in the 1918. But anyway, most of us never been to a pandemic. And I think what I've learned from this pandemic that hopefully there's none in the future, but if ever there is one, there should be a united front, same communication and consistent communication for everybody. Because I think what's happening to us is there's a lot of noises. And when I say noise, that's the misinformation. And we are not focused on something that all of us should follow. And because of that, anyone can just do whatever they want to do. Compared to other countries when their leadership, government leader says, we need to do this, we need to do that, and they all followed. Their numbers are lower than what we have. And to know that United States is the number one in terms of incidents and death in the whole world, I think that's a very disappointing thing. Because, we as a country, We have the money, we have all the technology, but a lot of people are dying. And it's certainly very disheartening to me, not only because I'm a pediatric nurse, but also to have for kids to die and the disease is preventable. It's really disheartening. It's so sad. Children are not supposed to die this early, right?
Yeah.
They're still so young. They have a lot of future ahead of them, but a lot of their lives are cut short because of COVID and because of something that could have been prevented.
So, Risa, what would then be your message to parents and caregivers of children who are eligible for the vaccine, but whose parents or caregivers are hesitant in signing up for the COVID vaccine for their children? What would you tell them?
It's very simple. They need their children to be vaccinated, and they should be the role model of their children. Because once mom and dad are vaccinated, or aunts and uncles are vaccinated, the children would say too, "Why can I not have that? If you think that that's also good for you, that also will be good for me, right?" So they need their children vaccinated. And if they don't want to be vaccinated, my plea to them is have your children vaccinated because you don't want their lives to be cut short because of a preventable disease. I mean, when you become a mom and a dad, you have plans and dreams for your children, right? And all of us have dreams for our kids to be doing well, to be dancing well, to be singing, whatever, and to have a happy life. And then for that to be cut short because of a preventable disease, I don't think that if I'm a mom, I would forgive myself. And I would say the same thing to a mom. And I have said that. And I've said that. And I said, if I have little children now, and even though the vaccine, is still new, because that's always the reason why they don't want their children vaccinated, right? Because they're afraid of the side effect. And it is understandable, because in any change, there's always going to be an early adopters and the late adopters. But you would just wish that those late adopters will have that decision before something happened to their children. And I said that to several of the moms that I've talked to, and that would ask me that I don't want my children's life to be cut short because of a preventable disease. Because you, as a mom or as a dad, you would try your best to do anything and everything for your children. And I think that's just, a fact for any kind of mom or dad.
Should a child that had COVID still get the vaccine?
Yeah. I mean, anyone, whether child or adult, they should still get a vaccine. And there's a stipulation in terms of the period. It's 90 days after they were diagnosed with COVID. They still need to get the vaccine because we don't know. As I said, the science on COVID is still new. So we don't know on how natural immunity or from the COVID disease, the acquired immunity from having COVID would last. We don't know that. I think the science that has come out derived from adults that had COVID, the antibodies would wane.
I see.
So that's why they still need to get the vaccine.
So, Risa, now children also have routine vaccines that they have to get, in addition to the COVID vaccine. So how does the COVID vaccine affect the schedule of the other routine vaccines for children?
I would say it depends on what age group these children we're talking about. Well, for number one, they can actually get other vaccines in addition to COVID, but that certainly creates an angst among parents, right? Because, you're giving me gazillion, but come to think about it, in scheduled vaccines, there are vaccines that are given, like MMR, DTaP are given together, right? So that's also is a lot. And certainly if you still add COVID and flu, and that's more. But only that portion of the age group they still are having frequent vaccination. So the older they are, the lesser vaccines they are getting. And so that should not be a problem. The only thing that we need to think of is giving flu vaccines, which is now to children, and in addition to also giving COVID vaccine because, the 12 and above are able to get vaccine now. And what if the 5 to 11 will also be approved, and that discussion with FDA and, CDC and what have you will going to happen, I think, 2 weeks from now, October 26th. And so that's coming up in November. So I'm sure the parents will have that anxiety of what to do, having to give flu and COVID together. So my advice right now to parents that, are listening or would be listening to this podcast is get the flu vaccine now, such that when that vaccine becomes available to your child in that age group lesser than 12 years of age, then only one vaccine can be given. So that angst of giving many vaccine, will be prevented because you are planning it. And that's what I told the parents: plan ahead of time. Not all of your kids are scheduled to have vaccine now, so planning will definitely help them in terms of anxiety and also in taking care of them because you don't know the reaction of children to the COVID vaccine. I mean, even us adults has reaction to it, and even a reaction to flu vaccine as well. So if you put that all together, that's probably where the anxiety is coming from. But if you plan it ahead of time, so it would be much better for parents to handle, I would say.
Have you seen worst outcomes from this disease?
Absolutely. That's why they're in intensive care, because I've seen worse outcomes. So those are rare though, but of course the rarest of all the outcomes will come to us. And in those are the kids that are diagnosed with what they call the MIS-C, the multi-inflammatory response syndrome. And because many of them, some MIS-Cs are not in the ICU, but there are a group of children that are in the intensive care, and they will be having a lot of supportive device, cardiorespiratory support device, including, ECMO. And, I'm also happy to say that amongst those, the children that are requiring a lot of support, they have gotten out of the ICU, except again, those that have a lot of comorbidities with chronic conditions.
Well, it's been a pleasure, Riza, speaking with you, and a wealth of knowledge you've shared with us and a lot of interesting stories. We thank you. And this is all that we have for this episode. I want to thank our guest, Dr. Riza Mauricio, and of course, my co-host, Mindy Ofiana, our director and producer, Rodney Cajudo, our executive producers, PNAA President, Dr. Mary Joy Garcia Dia, and PNAA Executive Director, Carmina Bautista, and our advisor, Nancy Hoff. And we will see you again next time here on Rise Up. Until then, keep on rising. See you next week. Thank you. Bye.
Bye-bye.
Bye.
Thank you. Bye.
Thank you too.
This publication was made possible by Cooperative Agreement CDC RFA IP 21-2106 from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of CDC HHS.